Lexington Morning News continues. We have Dr. Kevin Kavanagh now, retired physician, founder of Health Watch USA. Dr. K, good morning, sir.
Good morning, Cruiser.
How are you?
Doing really good this morning. Thank you.
Excellent. Now, the CDC relaxed their guidelines considerably last week. Is it your feeling that there is enough inoculation out there and or antibodies immunity that people have built up by having the COVID virus that we can stop with the social distancing and change the quarantine rules?
Well, I'm a little concerned. I'll be honest with you. I think that their relaxation of guidelines is, I wonder if they're just kind of throwing up their hands and thinking, well, we can't really budge society more, so we're just going to kind of lay down and give in. I don't think they're very advised at this point. I think they're ill-advised. The problem is, look, we still have the virus having a surge throughout our communities. Nationally, we have almost 500 people dying every day. We have the problem with long COVID. More information's coming out that that's starting to put a strain on our workforce, possibly affecting 2.4% of our workforce. And at this time, I'm not really sure you want to relax the guidelines. The vaccines are being reformulated, and they're being reformulated for a reason. They're not that effective in preventing infections or spread. They still are efficacious as far as helping to prevent hospitalizations and deaths, which is important, but people are still getting very sick. They're still getting long COVID. Reformulated vaccines going to be out in the fall. For me, I would prefer to wait until that reformulated vaccine is out. And what's interesting is about the same day the CDC released these guidelines, the FDA released their guidelines that before someone should come out of isolation, after you've been exposed to the virus, you've become infected, and now you are isolating, you should have 3 negative tests over 5 days. And so the FDA is much more stringent than the CDC. And we're also getting really good guidance on how to prevent the infections. For example, there's a Yale study that has just been published that if you test everybody with a rapid test the same day prior to an event, you can decrease spread by 50%. And there's another study from Harvard and the Boston Public Health Commission, which found that schools that had masking versus their schools that didn't have masking had the total infections, 30% of which was accounted for by schools that weren't masking. And so that to me is problematic. There's a lot of things we can do to slow down spread, prevent long COVID. And now when we have the virus still up there at a fairly high plateau, to release guidelines, to me, doesn't make sense.
Well, we don't know what the fall and winter will bring, too, as more people move indoors. And I've seen, Doctor, where flu cases have been up what they have been over the last couple of years in those areas of the world that have either had their flu season or are having it now. Are you hearing the same thing, that we may need to brace ourselves this year for an outbreak of flu that we haven't seen during the COVID pandemic?
Yes, I think that the flu is at a risk. Monkeypox is at risk. Right now it is just in the gay community, but in Africa, it doesn't really have that sort of distinction. It can infect children and people, it can infect animals and pets. It's highly infectious. And I think we're in for some trouble. There's also new research out there that having COVID can affect your immunity and ability to fight off infections. That doesn't happen in everybody, but it happens in certainly a select number of people, and this may occur in the elderly, which are more at risk for infections and disease in general. So the time of relaxing guidelines, when we're seeing monkeypox surging, polio is starting to reemerge. CDC finally gave out a warning just a few days ago. We talked about this on the program last week. They are now culturing the virus in the sewage of New York City. It's really not a good time to be saying, hey, we should be relaxing public health measures. We do need to make sure that people can live with the virus. But for me, when you're high risk, if you're going in, you'd like to have the option of having curbside pickup, have someone deliver that curbside pickup wearing a mask. Businesses could certainly be setting aside 1 or 2 hours a week for people that are at high risk or elderly to come in and shopping where masking is required. You can improve ventilation in buildings, and people can start wearing and getting N95 masks. The purchasing of N95 masks, I think, is extremely important, and they're readily available on the internet. And all of that is advice that I think is different than what CDC's advice is, that for many signaling, hey, the pandemic's over, we don't need to do much. And let's face it, if you have to isolate when you're infected so you don't spread the disease, but not quarantine with a virus that has a high degree of asymptomatic spread, possibly over 50% of the cases, you're not going to do what you need to do in order to stop the spread of the virus, because you're going to have asymptomatic spread. And when you look at schools, yes, the kids are less likely to get severely sick, but they still can. It is rare, but it still can happen. But what they can do is spread the disease to their caregivers and among each other. And that's something that you don't want to have happen. And in addition, children are still susceptible to long COVID. So I think there's a lot of concern here, and the CDC, I feel, is far too lenient on their advisements.
On the polio, I thought we'd eradicated that with the polio vaccine. I thought as far as monkeypox, if you were vaccinated against smallpox, now I know maybe the smallpox mandatory vaccination for school kids, did that not end in the 70s? But I thought we were still vaccinating children as far as polio is concerned. Is this stuff just coming back? I mean, you mentioned the monkeypox. I mean, you got to have some pretty prolonged physical contact with somebody. It doesn't spread through the air as easily as COVID does. But I thought we'd eradicated most of this stuff for the most part. Are these just uninoculated individuals picking up the monkeypox and the polio particularly?
Well, that's correct, especially with polio. You have to realize that when you have figures out there saying, well, 80% of the population has to be vaccinated to stop the spread of polio, or 90% has to be vaccinated to stop the spread. That's in the context of everybody's vaccinated equally throughout society. But what you find now is, because this has become somewhat of a political issue, that people who are unvaccinated tend to intermingle together and will visit each other together among communities, that they can now spread the virus within their small group. And that is what I think we're seeing. And also, the vaccinations can wane. Polio is very problematic to stop the spread because 75% of the cases, or almost 75% of the cases, spread asymptomatically. Another 25% have a flu-like symptom. Only about 1 in 200 present with paralysis, and death is somewhere between 1 to 2,000 to 1 to 10,000. So COVID statistics are much worse than polio. And of course, what I'm worried is that our laissez-faire attitude towards COVID is going to spill over to polio, which, unlike COVID, really does strike the young and paralyze the young for their entire life. And that's the problem, is some kids have irreversible polio. Of course, this can happen with adults too, but children can be very susceptible. And when you talk about requiring people to get polio vaccines, I mean, most states have that requirement, but as you know, there are opt-outs in many states for a number of reasons. And because of that, we may not have a high enough vaccination level in many of our communities. Right now, there have been 7 sewage samples in 2 adjacent counties, plus the city of New York, which is positive for the polio virus. So for every case that you're seeing of paralytic polio, you probably have 200 to 300 other cases that are spreading silently within the community. And polio has an R0 between 5 to 7, which is much more infectious than, for example, the flu, which on average has an R0 of 1.3, which means one person infected will on average spread it to 1.3 other people. So it's very concerning. People need to get vaccinated. They need to get vaccinated for polio. Monkeypox right now, people just simply need to avoid close contact or intimate contact with strangers. I mean, we don't have enough monkeypox vaccine. They're talking about diluting it out and giving it subcutaneous, and there's a big debate over whether or not that's effective. I mean, come on, change your behavior and cut down the spread. This is what needs to get done. This type of free sex, free love in our societies is something that is not compatible with stopping the spread of these diseases. And goodness, if you can't stop the spread of monkeypox, we're certainly not going to stop the spread of COVID. I mean, that's the bottom line.
And there's then some political or social implications because the CDC is not actually saying or telling people just what you said. They're not saying that because this does seem to impact the gay community and there could be some political repercussions. So we handle that a little bit more with kid gloves. Dr. Kevin Kavanagh, retired physician. What's the website address for HealthWatch USA, doctor?
It's healthwatchusa.org. And also we have a conference site, healthconference.org, with a really world-renowned speakers and dynamite conference coming up on September 14th. It's free for all to view.
Excellent. Dr. Kevin Kavanagh, thank you, doctor.
Thank you, sir.
Have a great day. Dr. Kevin Kavanagh here on the Lexington Morning News with Jack Patty, Cruiser filling in.